Okay, so hello. Yes. Hi, my name is Heather Tran, and I'm with an organization called the Better Society. And today I'm here to talk about the Carver County Family Resource Center. And a Better Society has a partnership with Carver County Health and Human Services and helped with the implementation and the sustainability piece with the Family Resource Center of Carver County. So today's presentation really is going to be looking at why a Family Resource Center in Carver County, what a Family Resource Center is, where we are right now, where we're going into the future, and just some stories about things that are going on right now and how you can help. So what is a Family Resource Center? A Family Resource Center is a community welcoming hub for support services, family education, and community building. Ultimately, it is the safe space that people are going to come in. They have trust built. The programs are tailored for the community that the Family Resource Center is part of. So looking at the cultural needs, the community needs, what are the different pieces that that community has, what are the demographics, and how do we best support families? The core services are focused really on parent education, basic needs, early childhood literacy, and other supports like that. And it is a place where individuals and organizations, whether it's county agencies or nonprofits or for-profits or community groups, we're all coming together to help families thrive. It is based on models that are nationwide. So if we look at the National Family Support Network, it's an organization that comes together to support kind of all family resource centers, give guidance of what they should look like, not necessarily physically look like, but what are the components of what should be in there. And then Minnesota has its own Community and Family Resource Network. Both of these slides are from late last year, so there has been expansion in our state and in the country, because right now you can see that Carver County is shown as in development, though we were open and running. That Minnesota Community and Family Resource Network meets with the Family Resource Centers throughout the state on a regular basis, monthly basis, talking about the things that they're seeing and connecting supports and materials with those Family Resource Centers and providing guidance. That network is now supported by the Wilder Foundation. It used to be the Sauer Family Foundation, and now the Wilder Foundation is helping with that, and they have a lot of knowledge in analysis of data and doing a lot of that stuff. The Wilder Foundation runs our Point in Time, which is looking at our homeless families in the state as well. So, nationwide model. There's a framework of how a Family Resource Center should look, but once you've seen one Family Resource Center, you've really seen one Family Resource Center, because they are meeting the needs of that specific community and what that community is looking for. There's a lot of analysis that's done, and the ultimate goal of a Family Resource Center really is to look at reducing the rate of child protective services claims and interventions in a community by wrapping families with the supports that they need, whether it's their basic needs, educational components, connections. A lot of the belonging piece falls in there as well. So that's where that comes from. And it's based on the principles, which I won't get big into, but it looks at 5 protective factors and a bunch of other things. So what will the Family Resource Center do? So the Family Resource Center helps families thrive together. It's that building connection with the supports in the community and building connections with each other. It's building that connected, healthy community, so we're all working together in this. And it promotes that child well-being through family supports. Okay, there. So it looks at services, family activities, and community resources. So a lot of those support services might be job placement, mental health supports, housing assistance. Those community resources are those outward referrals, so getting families connected to food shelves, Love Inc., other nonprofits that are in the community or for-profits. And then those basic needs. So the benefits of the Family Resource Center model. It's an opportunity to bring those services together. So it's not the county offices where we just have the county, or just Bountiful Basket where they have food and some navigation support. It's bringing those supports together, or at least those referrals coming out of the same place where we're working. Not everything lives within the Family Resource Center. It is not a one-stop shop. It is a next best step. It is, how do we understand what the supports are in a community, get people connected to those supports, and have some of those on site. It is a more efficient way to do referrals. So a lot of what happens, and I'll get a little more into it, but at the Family Resource Center, we have staff on site, navigators, that will call families, will call like the food shelf with families, or call housing with families, or call Love Inc. with families, to teach them how to do those processes. They also are helping families with understanding how to fill out paperwork or applications or things like that. And it is shifting from that reactive to proactive. So instead of just meeting those basic needs, this family needs food, it's looking at why families might need food. What are the things, those underlying things that are making it hard for them to get access to food? It could be transportation. It could be that they had a job loss. There are a lot of different things. So the Family Resource Center is not intended to replace all the incredible work that is going on throughout our county at all. There's a lot of stuff that is going on, but it is one piece of a larger plan that we're doing of helping people navigate the system better, and to make it a little simpler. It's always going to be complex, but having that place where families can go to get their questions answered, or to understand how to navigate the system and get access. There are other places within our community that people can go for some of the support, but it is bringing it all together and bringing some of those government supports to a place that is not necessarily the government location. So why does Carver County even need a Family Resource Center? Back in 2023, Carver County Health and Human Services wrote a grant to Sauer Family Foundation to receive funding to have the Improve group do an assessment of our community and do one-on-one or small group interviews with individuals and families in our community with lived experience, and then also having conversations with some of our support partners that are working heavily with those individuals with lived experience. It was a longer process of surveying people. We had 168 people throughout Carver County that were surveyed at some level. Some of them were like the nonprofit leaders, like Love Inc. leaders and Bountiful Basket leaders. And then it was meeting with like the families at Beyond New Beginning, or at the Humanity Alliance, or sitting down with some other groups of individuals. It's making sure that we're meeting with our Spanish-speaking community or our East African community, and making sure as well that we hit all 11 cities and townships. So that surveying was broad. It was a smaller group of individuals, but we were trying to figure out, do we even need a Family Resource Center? You know, where should it be? What should it look like? What is your envisioning of this? I was privileged to be part of the surveyors at that point. So worked with the Improve group, and I sat with the moms at Beyond New Beginnings and with the Humanity Alliance, and did some one-on-one surveys, and just getting to understand their pressure points in accessing services. So all of that educational piece, and then even actually two of our navigators on site at the Family Resource Center helped with those interviews as well, to really understand what the community needs. So when we identify those needs, this is what we learned. We learned that the community surveyed this survey of the 168 individuals and leaders, and they were things that we knew, right? But we needed clarity from it, and do we need a Family Resource Center at all? Some of the biggest pressure points are housing assistance. How do I get access to, I am either homeless or I don't have the right housing. How do I navigate that system? I need help with rent. that healthy food education and distribution. Where do I find food in my community? And how do I find the food that my community needs? Looking at government assistance eligibility, it's hard to navigate that piece of it. And there are misunderstandings even within our nonprofit community on how those government assistance things work, but having those experts within those departments sharing that information and connecting families to resources, that peer recovery coaching sessions, or even just peer-to-peer individuals with lived experience helping families through the supports that they need, job placement, family programming, immediate crisis intervention. When you're in intense crisis, it's really hard sometimes to know what to do, and you need someone to listen to you and understand it and help you figure out your next best step. And then transportation is always a big issue. And it's going to be for a while, but it was noted that transportation was an issue. So the biggest concerns boil into housing. We have limited access or limited options for large families and multi-generational families. There's an increase in housing costs that are impacting our older adults and those individuals on fixed incomes. With food insecurity, there aren't as many options of supports out in our rural communities in the western part of the county. We do have food shelves out there. We have food distributions, but they're not in all locations. And then transportation sometimes is a big issue, accessing those food supports, right? So, or any supports. When we look at food insecurity, I'm part of the Hunger Relief Collaborative as well. We have 11 cities and townships, or 11 cities and towns plus a bunch of townships. There's only 3 or 4 of our cities or towns that actually have grocery stores. And we have food deserts, not traditionally named food deserts, because I think the state of Minnesota and the federal government have it based on population density. Ours is a distance piece. So Norwood Young America, Cologne, New Germany, they don't have a grocery store, and they're individuals who have transportation issues, and they're food insecure, not necessarily because they're financially struggling, but because they don't have access to transportation. That mental health access and support, we all know that's a big issue, and that accessibility, really looking at how are we meeting the needs of people that maybe have a language barrier, or making sure that it's accessible for anyone who's in a wheelchair. There's a lot of different accessibility issues that we're looking at, and that whole diversity piece. Where do people feel comfortable? Interesting with this. So this was in 2023 when we did the survey with families for the Family Resource Center, looking at that. These align with what we found with the community health assessment that was being done at the same time. That was a broader survey. So for me, it's like they prove each other, right? Where we knew what we thought, and they were what we thought was going on already. So we have that proof to show it. Clearly, families said we need a place. We needed to be brick and mortar. That was when I was meeting with people and when others were meeting with people. They wanted a brick and mortar place. Some communities, and it doesn't mean that we won't grow to that, some communities have all satellite sites or all mobile sites, where that's where Scott County started with their Family Resource Center, where they had locations throughout the community where the Family Resource Center services would be on a weekly basis. Our family said we want brick and mortar first. We want to have a place that we can go to that we know is safe and welcoming, that we can go to get help. They also very clearly said the 2 locations that they would want us to start with were Chaska and Waconia, and even the western side of the county said, I think we should start with Chaska and then try to figure out how to move further. The families, when I was meeting with the families at the Beyond New Beginnings, one of their biggest struggles, concerns, things that they wanted was to be able to walk into a place, have their kids with them, and know that they were welcomed, to know that it was a safe space, that someone wasn't gonna sigh, like, okay, now we got kids, you know, and that they can get more than one thing done. Like that was one of their biggest things. Once we had the survey data, we formed a steering committee. So Carver County Health and Human Services, after knowing that, yes, we needed a family resource center, the improved group assessment was done. They applied again to Sauer Family Foundation and got a 2-year grant from Sauer Family to fund implementation and opening of the Family Resource Center. They partnered with A Better Society. We do a lot of convening community partners together and tackling bigger issues like homelessness, food insecurity, things like that. So they asked if we would be a part of that, and we did a lot of that implementation and getting this thing off the ground. One of the first things that we did was bringing together a steering committee. It was an intentional steering committee. We knew that we had partners that were going to be on-site supports, making sure that we're meeting the needs of our community. Mikasa and Community Resource Center are 2 of those partners. They are bilingual, so we have one serving our Spanish-speaking population, the other supporting our East African populations. Everyone that does navigation support supports everyone. So it's not just a Spanish-speaking navigator or a Somali-speaking navigator. They can support anyone, but we wanted to make sure that that cultural sensitivity was in there because we need to understand their needs. And then getting the CDA Love Inc., a couple food shelves, the chamber in there so that we can connect back to the business communities. We had public health representation and health and human services representation, and the city of Chaska was part of that. So every step of the way, after taking all of that information that we learned, we then had to say, now what? Now what are we gonna do? First thing we did was let's collect a list of all the possible places we could put this thing. Let's look at it. Could it be a library, a school, a government building, a business, like an office park, a faith community? There were all of these things on the table. Families were very clear that they wanted it to be a brick and mortar location, a space that they knew where it was going to be, that it was going to be there at the same time every week, and that it was accessible to them, warm and welcoming. We made a list of 90 possible, it was probably even more, locations that it could be at. It could be, we looked at all the government spaces, the city spaces, the libraries, the faith communities, businesses. We looked at renting spaces. We did not physically go to 90, but we would have conversations with school districts to say, what could this look like with you? And it became clear that access would not be on a weekly basis. It could be a good drop-in space. Libraries are the same way. We can't have this space the same time every week. City spaces as well, and government spaces. So we kept looking. We looked at what would it look like to rent a space. So looked at some retail space to rent. The cost was too much. We didn't have money for that. The county has provided money to be able to fund services on site, whether it's their own services, an on-site coordinator who is a paid staff at the county, paying those navigators, paying for the technology, but holding a lease, paying the rent, and doing insurance pieces are not something that the county can fund, but the county has dedicated funding for the next about 3 years to pay for those on-site supports. So then what? We had to keep whittling down space ideas. It was very clear it needed to be safe, welcoming, and accessible. Private meeting spaces, community rooms, it's child-friendly, maybe a little kitchenette, a place where you can heat up your food or provide a meal. Child-friendly was critically important. When I met with the Beyond New Beginnings moms, they were like, I want to be able to know that I can bring my kids in and feel safe. It was clear from our interviews as well that government spaces are not always spaces that people are comfortable coming to. It is the spaces where our sheriff and police are located. If you go down to the county offices, it's also where our jail is and our court system. So they were like, It's not optimal. There isn't even space there right now. It would be hard to get that in there. So after looking and then having a conversation with the former pastor of the Chaska Moravian Church in downtown Chaska, we were able to find space that was affordable, find space that was warm and welcoming, trusted. Chaska Moravian Church has served for as long as I know, supporting nonprofits, being a place where other nonprofits have been housed. They have their community meal, their monthly community meal, so families feel safe going in there. And the sanctuary space is separate from their kind of meeting space, so it is a safe space. We did have conversations with our East African community and with other communities that a faith location could be a barrier, and they said it's more important that we get it open than it's perfect at the start, but then as we look at expanding or looking at other places, make sure that we have that awareness in there. So there's about 3,000 square feet in the Chaska Moravian Church. There's a space in the front where you can do one-on-one meetings or small group meetings, support group meetings, or parenting gatherings. There's a larger space that's where they do their community meal, but we can do events in there, trainings, different things like that. There's two other rooms. One's a smaller room for good one-on-one conversations, and then there's a nursery toddler room, which is great for ECFE classes and things like that. It's ADA accessible. It is this kind of warm and welcoming place. It's bright, it's beautiful. We'd love to have you come visit. So let's see, I better move in. Let me look at something. Sorry. Is there anything I need to know? So we recognize that every location has strengths and barriers. The church was affordable. They wanted to partner with us. So we found some great spaces, but there's no rent to cover it. So the Chaska Moravian Church is giving a good rate for this. At this moment, A Better Society holds the lease. A Better Society is paying the rent. We will be, and in this next season, looking at how do we fund that on a sustainable way? How do we make sure that we get the community involved? So we'll be reaching out to individuals, supporters, and others. So we'll be connecting with Lions clubs, Rotary clubs, service clubs, businesses to sponsor the Family Resource Center on the rent, insurance, and ongoing miscellaneous supports. But right now we're covering that piece of it. And that price, location, safety, all of that directed us to using the Chaska Moravian Church. The location is great. It's downtown Chaska. That's where families are. That's where families come for support. They come there a lot already. So that's what we ended up doing. And it's more important what people experience when they walk through the door. So after signing the lease, we did a soft launch phase 1, very limited hours, bringing county staff in, our navigator staff in, testing it out. Does this work? If families showed up, which I think they did, right away, but they were there because they knew the Chaska Moravian Church was a safe space, so they were coming in going, I don't know what to do. I think we had a homeless gentleman come in, and we were able to get him connected to shelter that evening. But very limited, looking at, does technology work? Can we get connected to the internet? What type of, what do we need? Printers, scanners, what are those key pieces that we need to have on site? Lockers for people to store things or keep things safe, and a lot of that logistics. So spending a little bit of time on limited hours in service to then move to that phase 2 the next month of opening up broader 4-hour windows 3 times a week. So Tuesdays, Wednesdays, Thursdays are the the days that the Family Resource Center is open, and having those on-site services. So Carver County departments that were on site at that point are listed here: housing supports, cash SNAP, healthcare, workforce, parent support, outreach. So someone who can help families get connected to some of those supports they need as families. We initially had food navigation and car seat information. We may look at bringing them back. They're not on site at this moment right now. And then our navigation benefits, having Mi Casa and Community Resource Center on site. Phase 3 was getting the word out. So marketing, branding, getting a website up, creating a logo, getting things live, having something that we can present to people to come see us. I have a lot of our marketing materials, flyers and things on a table in the back that you can take with you, but getting that going so that we can start sharing information about the Family Resource Centers and get people to come. Oh, and in October as well, we did have a fall family fun event. Families coming in, doing fall events, fall celebrations. So we had a good turnout for that to then do our grand opening November 18th. And there were 95 people at our grand opening. It was beautiful. So this center represents what can happen when people come together with a shared vision. In partnership with Carver County and a wide network of nonprofit organizations, we've created something truly meaningful. This has always been about collaboration, about recognizing that no single organization can meet every need, but together we can create pathways, remove barriers, and build connections, and that strengthen the entire community. So grand opening was lovely. And we're like, okay, we're gonna get people coming through the door. So after the grand opening, I'm gonna talk a little bit about next steps and then things that we've moved on site. We'll look at metrics in a little bit. So next steps are really establishing that ongoing rotation of workshops and services to have on site. What is the rhythm? What are we seeing? How many people are coming in for housing? Do we need to add extra? We have some other supports that are on site, just being aware of who's coming in and asking for support. Having regular meetings with the Family Resource Center Advisory Committee. So at the end of last year, we folded the steering committee because the steering committee was getting it up and running. Advisory is a group that is part of the steering committee, but it is also other individuals within the county. So we have a county commissioner on that. County staff, nonprofit leaders, and they come together on a regular basis looking at marketing and outreach, at sustainability, at all of these different pieces and making sure that we're still moving forward. It's the next step as well as establishing a family advisory committee, individuals with lived experience within our community to guide what services we should have on site. We have 2 applicants so far. It would be nice if we had 5 on the board, so we need a few more applicants. So we are looking at this point actively at trying to find a few more individuals with lived experience that have capacity to support this. There is a stipend available for that and some other supports that we will do with that, but trying to reach out to organizations who have individuals who have come to a place of stability that can come and help with this guiding. Very intentional outreach into the community. You could table every day. That's the way that it works in our community. I could be up at the farmer's market. There are a lot of places I could be, all the community gatherings. The Family Resource Center has an on-site coordinator right now. Her name is Betsy. Betsy and I are doing a lot of this community intentional outreach right now, going to all of the free produce markets at least once a month, because that's where the families that need support are. Making sure that we're at the Love Inc. Backpack giveaways. Earlier this week, we were at the Chaska Cubs because we were invited and we were highlighted there, and it was a great way just to meet families. But intentional outreach, getting connected with those families that need the support and getting the word out. And like I said, we could be doing it every day. It could be a full-time job, but we're trying to be intentional right now. Then we need to secure that community funding for operations, the rent, utilities, additional supplies. It's that space that's on top of what the county is already doing. It is about $15,000 a year is what we're estimating for rent, insurance, some of those operating costs. we're going to look at in this next year, so by the end of July of next year, having raised about 3 years worth of support so that we have a sustainability plan. That's our long goal, but what would that look like? Expand the services eventually, not necessarily in 2026, but when the time comes and we have sustainability at the current space, once we know that this is the right location, if we have outgrown it, all of those things, but looking at Western Carver County. So we're always thinking about what would be a good location to do satellites and how often, and working on that sustainability plan. So what's new? After we started last year, we had on-site supports. You know, we had those clear individuals that were on-site. We started adding. U of M Extension has a financial wellness consultant. She is there once a month. She's at other locations as well, but we'll do one-on-one conversations with families to help them with budgeting or getting bank accounts or different things like that. I do believe she's speaking at Communities of Belonging about some financial things as well in September. I can't remember the exact date, but she's really great and has conversations with families that when they need help with that. We've had a number of dental clinics. We have one coming up again in August. Early childhood family education and takes place during the school year. So they do ECFE on wheels and come in and twice a month are providing some of that ECFE parent play story time with families. Smurls does legal consultation. We just started that, I think, it was maybe earlier this month. I can't remember, but that's the South Metro Region's legal services. They're a free legal support. They can bring lawyers on site, so they're looking at having a rotation of lawyers every month come in, whether they're immigration, housing, or family practice, or any of those things. So they're looking at figuring out their rotation, but they'll have someone generally on site once a month. Southern Valley Alliance is there once a month as well to answer questions about domestic violence or help do an intake if someone is experiencing domestic violence. And then later on this year, it will be after the summer and into the fall and winter. We are looking at, with the University of Minnesota Extension, again, different part of it, having cooking classes that are specifically to support our Spanish-speaking families. NAMI will be on site for a support group for caregivers. The home and community-based service workers, so HCBC, those that support individuals that have a disability or need extra support, they're going to look at being on site once a month. And then in September, we have a tenant and landlord law training from Homeline, I think is what it is. I have a flyer. There'll be a flyer you'll see. But trying to figure out what supports we need. When we get that family advisory, parent advisory board, they will guide some of this as well. What are families looking for? How do we find those connections? With all of this, and I feel like I'm talking a lot, and you'll have questions, but what does success look like? When our vision becomes reality, people know that there's a welcoming place to turn for support. County government, nonprofits, community organizations, volunteers, and families work together instead of working in silos. So we're coming together to support our families, to help them thrive, to make them stronger. And communities are stronger because barriers are reduced and connections are built. This is a long game. Family resource centers take time. It's trust building. Families come in once and they'll come in again and they'll come in for other support. So it is that, like I said, that upstream, very proactive work. So, impact of the Family Resource Center. I anecdotally heard from a lot of the county workers. I was actually the on-site coordinator for 9 months, helping families as they walked through the door, understanding what they were going through. That was part of what a Better Society was doing when we were doing this implementation piece. So the workers would tell me what they were seeing and how they experienced, and I said, okay, can we write this down? So one of the financial workers shared, Just wanted to share my feedback with you from an intake I did this morning. I've done that type of interview hundreds of times in the past at the government building, and it feels so much more personal in this setting. I feel there was no rush to complete the process and that the client was comfortable sharing more information so that I could better assist her. All in all, I would say it was refreshing. So just knowing that, like, until we could get someone coming in specifically and meeting with that county worker to have them understand how this is different. It's a hard thing to come and even make an appointment with a financial worker or make an appointment with a SNAP benefits person, because sometimes you don't even know what you need to ask, or you may not even know that that's the person you need to talk to. And having those supports on site allow for these conversations to happen, for people to understand what is available for them and then how to apply for those things and get those supports that they need. And I did this week get a couple impact stories from Betsy that were recent. So I'm going to read those. I've summarized them here. So first story is a young family came to the Family Resource Center after arriving in Minnesota from another country. They were trying to build a new life while caring for 2 young children, but they were facing a utility shut-off, behind on rent, and struggling to put food on the table. The FRC brought partners together. They connected them with emergency food, utility assistance, and housing support, and staff walked alongside them to complete applications and gather the documentation needed for assistance. Because of that coordinated effort, their utilities were restored, their housing was stabilized, and they avoided eviction. They left not only with their immediate needs met, but with hope and confidence that they weren't alone. Sometimes the greatest gift we can offer is helping someone believe that tomorrow will be better than today. So that's one of the stories. The second story that I have, there was a woman that was experiencing domestic violence that came into the Family Resource Center after losing her home and support system. She was overwhelmed and unsure where to turn, and simply needed someone to listen and help her find a safe place. Our staff sat with her, explored every available option, and contacted multiple agencies until safe shelter was found that could provide both immediate housing and ongoing support. Within a day, she was on her way to a place where she could begin rebuilding her life. Her story reminds us that the Family Resource Center is more than a place that provides referrals. It's a place where people are met with compassion, where someone stays with them through the hardest moments, and where hope begins with a single conversation. So the impact isn't that we fill out forms. We do help them fill out forms. We do an intake. We get information from them so that we can support them better. And the impact is that families don't have to navigate these situations by themselves. There's someone there that understands it and can help them and has knowledge of not only what the government can do, but what nonprofits in the community can do. And that we're building something and we're building it together with trusted partners, removing those barriers and walking alongside families. So they just tell a part of the story of the people that we serve, and they help us understand that the work matters. These are the things that are going on every day, and some of these things are happening with our partners as well. They're happening at Bountiful Basket and other places, but we're trying to create something where people know that they can come for that support. Metrics, we do collect metrics. We count who comes in the door, staff that's on site. Visitors are people that come to tour the space or have a meeting there or things like that. And then total clients. So the clients, it's hard to see the colors. It's hard to see the colors. So staff is this one, orange is visitors, and green is clients. So we had upticks. I know, when we come into the last 3 months, there's a few things that I think are missed on there. We had a few dental clinics, and we had a community gathering, and I think some of the numbers we didn't get all the way in there. But what this shows is it looks heavy on the staff, but you have to consider that every day that we're open, and we're open 3 days a week, we have between 3 or 5 or 6 staff. And staff aren't just county staff. Staff are our community partners, or the U of M extension, or the dentist and the hygienist. Like that, we're considering everyone's staff. So those are those numbers. Visitors, big upticks would be in October, November, and April should have a bigger uptick because we had a family family gathering that time. Clients include individuals that walk through the door, individuals that make phone calls, or individuals that do emails. A bulk of the clients are on site, getting supports, getting those connections. You can see numbers they're wonky, right? We started having an uptick here, and then we had a downtick. And there were things going on in our community in January where people were not safe coming anywhere. So then we started pivoting to say, okay, how do we do phone calls? How do we do emails? How do we do some of that work? Numbers kind of go up and down. April and May, I think the numbers, probably school coming to an end, there are understandings. And even though it may feel like things are back to normal, whatever normal is, there's still fear. But we can see that in June our numbers are going up again, right? So they just tell a piece of the story. These are the people that walk through the door. We're also collecting where we're connecting them to. What supports are they asking for? So we know that, I think it was one day last week or a couple weeks ago, on a housing day, which is Tuesday, the housing worker was busy the whole time, right? Okay, do we need another day for housing? Like, those are the things we look at. We're also working on getting an exit survey on the back end for families that are in the space to ask them, you know, how was your visit? Did you get what you needed? What else could we help with? So we will be collecting all that data. I didn't want to do death by data, so you get one snapshot of it, and there's a lot more that we have. So, other things that I thought would be helpful: July calendar. On the back table, we have July, August, and September back there. On the other side of this calendar, we always have information about the Family Resource Center, and we have an English, Spanish, and Somali at this moment. So you can see there's a rhythm. Tuesdays, we have cash SNAP benefits, housing, and our resource navigators are there every day. Wednesdays is our career force day, and generally our parent support outreach person is on site. Thursdays are healthcare, and then we also have Southern Valley Alliance there once a month, financial counseling there once a month. SMERLs, they must not have come in July. There's dental clinics. So this is a snapshot, a way to see what's available. There's a website as well on the county website that has the up-to-date calendar, so if something gets added after print. Things that are coming up. In August, there's a back-to-school health and wellness event where families can come in, connect with supports in our community. I know our health providers will be there. They can sign up for vaccines. They can receive some school supplies to have at home to help them when their kids are there, some mental health access, fun and food, all of those things. Everything that we do at the Family Resource Center is free. That's the other key piece. Free or low cost. You know, the dental clinic may have a charge to it, but everything else is free or really low cost. We want it accessible to everyone. So we're not going to have an ECFE class that you have to pay for, or things like that. Homeline is coming as well in September to do the tenant landlord law training. And I think there are some other things, and you can see that on the flyers in the back. So my last invitation, and then we can do questions and answers, is being part of the story. So our vision is that everyone in Carver County knows there is a welcoming place to turn for support. They know that the Family Resource Center exists and they can help them navigate this system. So you can help by sharing what you learned today. It's being recorded, we can share it out. You can take a flyer, share it with someone that you know, or talk about it. If you know of anyone who could benefit from supports, it's not just for our families that are financially struggling. It's for anyone who needs help connecting to supports. We have seniors that show up and just don't know where to go for their support. So we can help with some of those pieces. So if you know someone who could use help, please send them our way. Invite us to speak with your organization or community. If you know of places that we should come and share this information, our goal in the next year as well is to meet with every one of the cities and go to the city council meetings so that they know what's going on here, meeting with all the Lions and the Rotary clubs, the senior commissions, all of those spaces. But if you know of someone else that would benefit from this presentation, please reach out and let us know. Visit the FRC, take a tour so that you can see what it is. You can understand it, but once you see it, you can see what we're building there and how it is this space for all families. Facebook has just started, so it's a very minimal Facebook page. It will be the place to go to learn more information. So follow it and share it. And then there will be information about what's going on at the Family Resource Center. And if you know of anyone who this really resonates with, there are opportunities to be part of the funding and sponsoring of the Family Resource Center moving forward. So, address, where we're located, a way to reach out. The phone number goes to voicemail and someone returns your call. Email address if you have any questions at all or want to learn more. Email that and we'll get back to you on that or answer questions when we're open, and then the links to where the website and the Facebook are. So, questions. That was I think that was a fire hose. Questions.
Okay, I have needs. How do I know that an FRC exists and why I should go there?
So that's that outreach.
That's a marketing issue.
That's a marketing. So it's that outreach piece, right? We're having to build it and create marketing at the same time. It's a parallel piece, right? You have to create it and then figure out what it is to get the information out. So we finally hit that capacity. People are coming through the door. So whatever we're doing, marketing is working. It's not as many as we know have needs, and we're not getting overwhelmed at this moment, but we do have a consistent population, individuals coming through the door. So it is that intentional outreach. It's doing these things, it's getting the county and the community, once the Facebook is going, pushed out to all of the other partners. Partners are referring back to us. So Loving, the CDA, other organizations, Bountiful Baskets, are sending individuals our way. But it really is, this next year is getting more people to come through the door for support. And it's that intentional outreach piece.
Are we telling people that come in for help, please, if you have friends or family that need help, please send them our way?
Exactly. And it was interesting, in the time that I was there, biggest needs that I saw, housing was huge. Like, housing was the biggest need, and it is the most complicated. And it's really hard because we do have to be honest with people. We may not have the answer to the thing that you think that you need in that moment. We might not get you housed that night, but we're going to try to get you connected to the supports that are going to get you your next best step. The other thing that I was seeing was a lot of individuals coming in to ask questions on behalf of somebody else. So my neighbor, my sister, my friend, my daughter, they don't know what to do. Can you help me? And then getting that understanding of, oh, this is a place that we can get those questions answered, and then they're bringing them, right? So we're getting that flow of individuals, or just popping in to say, what is this place? And then getting more information out there. We're on that the Chaska Moravian Church is on a place where people travel, right? The government center's down at the end, the CDA's across the street. Like, there's places there that people get support. The little free pantry's on the corner. And so we watch that. When someone slows down, right now, and it will continue to be this way, the Family Resource Center front doors are locked and we open and welcome people in. It's a safety piece, but it also is, we're watching and we're getting up and letting them in and asking how we can help. So if you're getting food, and we have a number of individuals down in Chaska that is their only source of food, is that little free pantry. There's no grocery store down there, and if they don't have transportation, they're getting all their meals from there. So we're trying to get them connected to other supports and doing that piece. So it's going to be a long road of getting the marketing out, but it is very intentional, and we need everyone's help to do it. So.
Thank you.
Yeah.
I don't know if this is a question for the Family Resource Center, but often I have seen, and this is something I witnessed during COVID, people that got laid off and started getting assistance from government or nonprofits. At some point, they realized that the assistance they were getting was far more affordable than having to work. And because once they start working, they're going to lose all of their assistance. Do you believe that there is hope for a transition at some point in income for those that are receiving benefits, that they're not going to be cut off immediately, because it takes a while to...
Right. Well, and I think if we look at, this gets messy, right? Like this conversation gets a little messy. A lot of those assistants are just naturally going to be falling. Right now, we are going to have adjustments to who qualifies for SNAP benefits, who qualifies for different benefits, and even restrictions or limitations on some of those things. So unfortunately, I think a majority of people are not using the system the way that you're talking about. Like there are some that, yes, it is, but it is not the norm. Most people are not this, and it's hard. Like it's a full-time job to do that to you, because it's still not enough. They're still having to go to the food shelves, the free food distributions. They're still getting support from other places and barely making ends meet. So the goal is, that's why we have Career Force on site, getting them connected to what they can do. And there's always going to be a portion of our population that is always going to need support. They're not going to be able to have a job that is going to pay for everything. There may be barriers, whether it's a disability, mental health, an addiction. So we're always going to have individuals that are going to need help, and the goal is to get them to their thriving point where they can sustain. It's a bigger issue. Like that's all I can say. I don't have the answer, but I think the number of people that you're describing are far fewer than the number of people that are really coming in for help. Yeah.
Thank you.
So if I'm a resident of New Germany, and you were talking about how New Germany doesn't have the option for muddy food shelves unless it's a pop-up, and they don't necessarily have a transportation issue, can they set up a phone call appointment or a Zoom appointment or?
Yes, so at this point, if somebody is outside our community and or outside of Chaska and cannot get to physically the location, they can make a phone call or email and someone will follow up on them. We're watching those. We're watching that number and looking at what does that look like, because we haven't had the need for it, but we are always having the conversation of doing online intake, online navigation, online conversations, and trying to figure out, will that be looking at it being a Teams call or something? Is it a phone call? What does that look like? With each of our interactions when we're doing in person, there's a lot of legal pieces. You think about when you go to the doctor and you have to do your HIPAA thing, like there are legal compliance that we have to do. We are getting sensitive information stored at the county. We need to be able to do referrals between agencies within the county and nonprofits. So there are Privacy things that are signed in there are authorizations for us to have communication with each other that we're working on. It gets complicated when we do virtual, and we're working through that process so that we're prepared when families start asking for those conversations. But a lot of it is, I just don't know where to go. So ultimately, figuring out where are those points of when we grow that we can be physically on site, but having those supports available via phone or email. A lot of them are answered via email right now, because someone's like, I'm at risk of losing my house. What do I do? And we get them connected to housing. So we're doing the referrals versus the intake, but we're watching it.
Well, and it's nice that people just have the option, like, I don't know what to do. I'm going to call these guys and maybe they'll at least point me in the right direction.
Yeah.
I bet you get people that may not be, they just don't know where to go.
Yeah.
And so it doesn't matter what money bracket they're in, they just don't know what to do. And so it's nice that they can just call you and your team can help.
Yep.
Do you have anyone that, because you have privacy information and because information is given to the county, where they're concerned and they leave because they don't want to sign the privacy information, they don't want to give out their personal information?
When I was there, there weren't individuals for that, and it wasn't that, it's the support may look a little different. If we can't do the one-on-one piece, it may land back on, we're going to provide you, here's a flyer to call. There may be some limitations of how we support someone if they're not able to sign that, because it's harder to have conversations about it, and we are aware of that privacy piece. There is also, like, we take all their information. The biggest question right now, and it's not that we're going to help someone that walks in the door from another, if someone from another county walks through, we're going to get them connected to their county supports. We need to have the right conversations at the front end to get them connected to their next. We can have a conversation with someone that walks in to understand what they're going to need, but the supports might look different if they're unable or uncomfortable signing those things. They'll probably receive like a paper, some of the paper flyers, or here's the phone number to call. We may not be able to do some of those things on their behalf without it. So I can't talk to Bountiful Basket or Love Inc. to let them know the story, because what we're ultimately trying to do is trauma-informed, like client, family-centered work, where that person isn't telling their story over and over and over again when we're doing referrals. But so we can find ways to get them still the help, but the help may just look a little different, if that makes sense.
Would the Family Resource Center help at all with understanding the election process and mailing ballots and any of that, or do you refer them to somewhere else?
We haven't had that question, so I don't know. And a lot of it is based on the needs, right? We have had supports that have come on site, and when we have supports that come on site, everyone has to be comfortable with some days you have to have your work. So when the U of M extension, when Samantha comes in from the U of M extension financial, there are days that she's working and returning phone calls because someone isn't necessarily walking in for support. So at this moment, people come in the urgent a lot. So they're not necessarily knowing who's physically on site at that moment. Or they see housing and they're like, oh, I have a housing question, right? That type of thing. I don't know. That's something that we could look at, and we need to understand that if it is the space that people would come to seek that need, because yes, it is a trusted space, but is it the right space, or is it the need of the community right now? It is a great question. Yeah, so it is like but it is like, I think it's a good question to ask. And as we look at what supports we have on site, always it goes back to what the community is asking for. It's always back to, is the community saying they need this, and is this the right place to get it? Or do we direct them somewhere else? And sometimes it is that. So it is sharing that, like school supplies. The example of families are going to need their school supplies. They're going to need backpacks and that big supply of all the things that they need. And how many schools do we have in our community, right? Family Resource Center is not the right space to try to meet that need because it's already met by Loving. So direct people to that support. So if there is an opportunity to have people learn more and it's offsite, we can do those connections. So I think that would be a valid thing, but we need to be really intentional about what we are on site and that it's the need that.
You got to know when to stay in your lane.
Right. And we want to direct people to the individuals, the organizations that have that knowledge and do it well. And sometimes that does require that we are directing offsite. Other?
I think my last question is, because you are partially funded by the county and by grants, are there things that you cannot recommend because of that restriction, not necessarily because you want to? For example, there's a lot of amazing nonprofits in Carver County. They do all sorts of crazy things. Can you recommend any of them? Like there's a lady who helps out with veterans, and she does a physical fitness program with them, and she has them come to her garage and work out. And so, but if she's not necessarily in relationship with Carver County, are you allowed to recommend her?
So yes, so it really is, and we're still working on, there is an intake process. We get basic information. Where do you live? What does your family makeup look like? Those types of things. We're working, you kind of hit into this, like what the Family Resource Center and what we're trying to do big picture with navigation in our community. Like there are spaces where there's a lot of supports in our community, and who holds all that knowledge and how do we get someone connected to it. We probably would lean on, like when you're having a conversation and there's trust there, we need to know that that person's a veteran, right? So there are key questions of supports within our community that fall into a certain thing that makes you different, right? This isn't in place now, but like there are different supports if you are a victim of domestic violence, different supports if you are a single mom with kids, if you're pregnant, if you're a veteran. There are all of these different supports if you are in support for addiction, different things like that. We need to get people to the place that can help them connect to all. So if we get a veteran, we're probably more likely to say, connect to your veteran service officer, and that veteran service officer is best equipped to have that wraparound conversation with you because you qualify for different. Like you're going to qualify for different housing supports, different pieces like that. Same with our seniors. We would direct them to Kara Cassidy, who's the county staff person that supports our seniors. And then if it's like a domestic violence situation, we would have them go to Southern Valley Alliance. So the supports that are out there, sometimes they're going to get a direct referral. A lot of times it's going to get them to the person because that person is going to need more than just what Revitalizing Veterans Dreams is providing if they're a veteran. And she could provide all, but there are other specific, like whether it's a veteran, like whether it's Revitalizing Veterans Dreams or another support, there's flags and honors, there's other supports that aren't going to be as nuanced. It's best to get to the subject matter expert that navigates that, if that makes sense. So yes, and we are in conversation all the time with Revitalizing Veterans Dreams. They direct people back to the Family Resource Center and back and forth. So it is part of a bigger picture where we're all coming together and understanding what each other is. And even, what Sin does with some of the work for veterans, she has to have it vetted by the VSO before some of her supports anyway. So it's better to go that way. So yes. It's complicated. That's all I can say. This work is complicated. Yep.
So the Family Resource Center model is, the ultimate goal is to reduce child abuse, right?
Mm-hmm.
So I've got actually two questions. One is, how are you connecting your work with those statistics.
Okay, yeah,
And then my guess is you are seeing people who don't have children, right? And are you, I mean, you must be like you must have like success measures, right? Indicators that are,
yeah.
show here's what we did with this and got this family connected or whatever. That's not without children, right?
Right.
So
So when we look at stats, so we could talk about stats forever. But one of the things that we're doing right now, because we're just starting, is looking at the stats at the child protection level, housing level, SNAP benefits level. So we have a baseline from the beginning of 2025 of where we are with a lot of that information now, to then year over year continue to watch what happens. And we have to be really careful when we look at rates going down, right? Because when you create a space like this where people can come in for support, the first thing that's going to happen is some things are going to go up, right? If we know that a person has some financial needs, we can get them connected to their cash and SNAP benefits, to career force, to their medical assistance, to other types of supports like that. So they're getting connected to that, and even connected to Loving, Bountiful Basket, those, we're going to see an uptick because families who don't know how to use the system or don't know how to get connected to the system are going to have their questions answered, and we're going to see an uptick of people seeking support because now they know where to go, right? It's really interesting when I think about, like, we study statistics on the Hunger Relief Collaborative a lot, and we look year over year, and we can see that outputs are going up at the food shelves and things like that. So yes, we're helping more people, but we can never know whether, yes, we're helping more people because we're getting the word out or because the need's going up. So it's a moving target. Like, everything is a moving target, but we are tracking it. So we're tracking at the county level. Other FRCs who have been around longer than us, so Scott County has 5 years worth of data. That's when we start seeing those numbers shift and the rates go down. And I know Scott County has started seeing some of that, but it is understanding what families need in order to succeed. And in order, like, is it education? Is it their basic needs? Is it housing? Is it someone they can trust? Like, what is that thing that is going to help that person get out of the cycle is what it is. So we track who's coming in, what they're seeking assistance from, where they're coming from. So we do have families coming from the western part of the county to get supports for us. So we are seeing that. We do see members that we were concerned about coming into a faith community are coming in. Like, so we're seeing that everyone is finding their space there, and now it is getting the word out. All of this intentional work, making sure that all of the faith communities know that this is a place to go. So very intentional, having conversations. It's laborious and worth it, but it is a lot of doing this type of thing and getting that information out so that people know where to send people when someone comes for help. Anything else? It's a lot. Okay.
Do you see a reasonable number of people that are non-Christian come to the wonderful?
Yeah. Yeah, and we don't ask that, but you can, I mean, it's like we can tell that the Chaska Moravian Church is a welcoming space, and it has been for a while, because Launch Ministry used to be there, His House used to be there. There are other organizations that are already utilizing that space. So it is this trusted, lower barrier. No place is barrier free. Like, some people aren't comfortable going into a school. Like, some people aren't comfortable, but it is lower barrier than some other places. So we are seeing families come in, and we're seeing them repeat come in. So, yep.
It's very encouraging that the fact that this is a faith community is not getting in the way.
Mm-hmm.
Well, Moravians aren't evangelical.
Right.
They're just a different group.
Yeah, the Moravians are, yeah, but and I don't want to get, like, it is, acts of service is what they lead by. So they are already feeding and housing. They have a house on site that they partner with another nonprofit to provide housing space. People live, that are coming out of treatment centers. So they walk the walk, right? And so they've built the trust, being the place that has the little free market, being the community meal, being a place where different groups have met. You know, I know that they've had at different times Spanish, like English classes, ESL classes, and things like that. So they are a trusted space. And it wasn't without hesitancy that we stepped into doing this, right? It was that awareness and conversations that we had to have with a broad number of people in the community. Yep.
Age.
Mm-hmm.
Do you see more teenagers,
Yeah.
20s, seniors?
I think we see a lot. It's probably 30s, 40s, maybe 50s. We did have a 90-year-old that came in recently, but it is, you know, and some of those connections are going to look different. We can connect if you're an individual that doesn't have kids. We're going to work to try to figure out where your next is, right? That your supports may not physically be on site. We may not necessarily have educational components or classes or things that are specific to seniors, but we'll get you connected to that place that they are. All of the things that are outside of those kind of basic SNAP cash benefits, housing, those different things, the special, the classes, the different things that are going on are going to be focused towards families, but we're not going to say you can't come if you don't have kids, because family is a very broad thing. But we may be referring you to another support.
Have you guys considered getting a hold of Southwest Transit and putting a signboard on the side of their buses? It says FRC, explains it.
We've considered a lot of things, and that is a conversation. I know that they had a marketing shift, so the person I was supposed to be connecting with their outreach marketing person is a new person, so every time I'm like, oh yeah, it's time to have the conversation. Some of that might run into funding, so.
It could be their donation for the cause.
Yeah, I think that Jerry's wants to be part of the fundraising and marketing person. Yep. Okay. Awesome. Thank you, everybody.
Thank you. Good job, Heather.